having access to quality healthcare services is a big deal. There's a recent young lady that died in Nigeria, and they said she died from snake bites. And I even heard that she drove herself to the hospital, but because the hospital did not have the medication to give to her, Antivenom, that was what led to her death. It's very unfortunate. We are so sad about it. She had a promising future, but that has now been cut short because of lack of access to quality healthcare services. I'm not saying that there can be healthcare issues anywhere in the world, but you know, when you hear very little things that government are taking care of in other places, you know, when the system is working, little things like this do not lead to your death. Yeah, there can be complications and other things, but when you just hear that someone had a snake bite, drove herself to the hospital, and she still died, you know, because the hospital she went to did not have the basic thing that they should have. You have snakes all around, you know that this is your season, you know that snakes are always everywhere. That is one of the things that hospitals should have. In Canada, where we don't have, I've not seen any snakes since I came to Canada. I've not set my eye on anyone, and I've not actually even heard that we have snakes around. But they still have those medications kept somewhere, just in case there's an emergency and you need it. They can provide it to you. Even apart from that, when you have an emergency here, all you just need to do is call 911, and in less than 5 minutes, you have an ambulance coming to pick you, coming to where you are. It's as simple as that. In less than 5 minutes, we have them all around, and in less than 5 minutes, or maybe like 5 minutes, they are there ready to take care of you and all of that. But someone that had a snake bite had to drive herself maybe to the hospital, you know, and still the hospital did not have what they need or what they can use to help the individual. So you see that even when you have the money, it's not just about having the funds. You may have the funds, but the system can still fail you when they should not fail you. That's it. Because when you hear little things like this causing people's deaths, it's a big issue. Accident happen, no first aid care, people are not knowledgeable about what to do. People just do things based on their own basic knowledge that they don't even have the know-how to carry out things. They just do things the way they think is best, and at the end of the day, they cause more damage or more problems for the individual. I said it earlier on some of my previous videos. If you watch it, one of the reasons why I migrated to Canada is because of the quality healthcare services. Healthcare is a major issue for me. I was comfortable in Nigeria when I traveled. I was doing fine. It's not like I was not doing fine. But when you have the funds and there are still issues that the system cannot help you with, or because of the way the system is, your likelihood of survival is very low. That's a big issue. I can't still forget when my dad had an accident too in Nigeria. You know, he broke his hand, you know, and the doctor said it was a simple fracture. Simple fracture is something that should not be difficult to take care of with POP and all of that. And they did all that for him, and after 2 weeks the consultant called and said, oh sorry, we have to operate that. It didn't work. The alignment was poor after applying POP, so they had to do surgery. They did surgery for him, and after 4 weeks again, he called again and said, oh, we need to do the surgery again. I'm like, wow, really? And that was what led us to moving him out of Nigeria to go and do the surgery elsewhere. And I still remember that when we got to where it was done overseas, the doctor asked him a simple question that I thought you said you guys are learned. How did you allow them to put this kind of thing in your dad's hand? They even asked him how did you allow them to put this kind of implant in your hand? So they used an archaic implants, things that are no more modern, that are no more used in this current age. And that was what was making the fracture to fail. It's on the surgery now for more than 7 years or 8 years. Yeah, I think almost 10 years now. And nothing. It's fine. We didn't have to repeat the surgery. So imagine we had taken him out at the first instance. He wouldn't have gone through surgery twice. So what am I trying to say? The system can fail you. Even when you think you have the funds and you're ready to pay, to get yourself treated, the system can still fail you. But in many other developed economies, it's not as if the system cannot fail, but the likelihood of the system failing is quite low compared with it failing where you are in Nigeria or some of these African countries. That's it. So systems are there that will help you sort out yourself at the first stage, and they are there to support you and help you out. For example, when someone had a sick mind, if you have a means of calling the ambulance, if they have ambulances, the ambulance has fuel to drive, they have a driver on ground and all of that, you can call an ambulance. I'm talking of if this happens in Nigeria, maybe you could call an ambulance that will come and pick you, take it to the hospital. And inside the ambulance too, there might be first aid things that will be there that they can administer at that point to reduce the severity of whatever will happen before they get to the hospital. But nothing like that is available. Nothing. It's so sad. And that's why we ask ourselves that many of our leaders have gone to develop economies. They see how things work. But the question is, what are they doing about it to ensure that the system in Nigeria works? I was speaking to an old colleague of mine yesterday, and he said the doctors and the health professionals in the teaching hospitals in Nigeria, they've been on strike since November 2025. We are currently now in February 2026. They have been on strike since November 2025. How then will that system work? How? Just imagine healthcare providers, professionals who are supposed to be there to take care of your health and all of that. They've been on strike since November 2025. Tertiary health institutions where we expect that we're supposed to have the consultants and the healthcare professionals who know what they are doing, who secondary and primary health care providers are supposed to refer to them for things that they cannot do. They are on strike. It's so sad. Sorry, it's the lady has gone. But the question is, will anything be done to prevent this from happening to someone else tomorrow? This is someone that we know. That's why we heard about it. That means there are so many people who would have had so many snake bites who have died and we don't know about them. We got to know her possibly because she's popular and because she's on social media and she posts a lot on social media and everybody, they know her on social media. And we got to know all this through social media. How about the millions of people who are not on social media who end up having snake bites, or who live in rural communities or rural communities who do not even have access to hospitals or primary health care or anything? What's their fate? We have a lot to do. There's a long way to go. We just pray that things get better, that our governments are able to assist to put things in place so that this will not affect too many people badly. We want to believe that when they are coming to this kind of place, they've come to Canada, they've been to US, they've been to other countries, they've seen how things work there. If these things work in Nigeria too, many of us will not be here. We'll be back home enjoying what they have created for us and all of that. So, this is what I have to say for today. And if you think you are also interested in coming to Canada, if healthcare is a big issue for you, you have the funds, but you think you want to have access to quality health services, you want to have access to free health services, you can reach out to me. I might be able to guide you on that. My WhatsApp number is +1 587 568 6124.